A sensitive exam can be a routine part of your physical health. We understand that everyone has different identities and experiences that they bring to their medical appointments. A sensitive or near-sensitive exam or procedure may be a new or uncomfortable experience for some students. Our commitment is to ensure that you feel safe, heard, and empowered during a sensitive or near-sensitive exam or any appointment you have at UHS.
A sensitive exam is any physical exam involving body parts that are typically covered by undergarments, including genitals, buttocks, the groin or pubic region, rectum, scrotal area, and breast or chest tissue. Depending on the type of sensitive exam, the exam can last from 1 to 5 minutes. A sensitive exam may be recommended for routine healthcare like Pap tests or IUDs, or for genital or chest concerns or symptoms. Your UHS provider will always discuss the reason a sensitive exam or procedure is recommended to ensure that you understand and consent to the treatment plan prior to proceeding. Every patient has a unique history and experience with their body. You may define certain body parts as sensitive or use different names for your body parts. Because you are a partner in your care plan, let us know if you use different terminology or if you consider other body parts to be sensitive.
Prior to the exam or procedure, your provider will ask specific information about your symptoms in order to provide the most appropriate care. The type of exam or procedure you might need depends on this information, so asking the questions and getting the right answers are important. We understand that talking about your health and your body is deeply personal, and you may feel uncertain about how to have this discussion with your provider. Let us know what we can do to help put you at ease so that there can be an open conversation about your needs and experience. The information you share with your provider is confidential. Once your clinician determines what examination needs to take place, they will review next steps with you. It's the clinician's responsibility to obtain informed consent from you prior to the examination. They will tell you what exam they think you need and why, make sure you fully understand, discuss a medical chaperone, and make sure you consent to the treatment plan. You will have an opportunity to ask your provider questions.
During a sensitive exam, we will give you privacy to undress and dress, provide drapes and gowns that allow you to adequately cover your body during an exam. Only uncover the parts of your body that need to be examined and keep them uncovered for the shortest time necessary. We will communicate with you using anatomical terminology or terminology you have previously discussed with your provider. And we will have an ongoing conversation with you during the exam. For example, the reason I'm going to do this is, at any time during this discussion or the exam, you have the right to ask questions or stop the exam.
You always have the right to request a medical chaperone be present during any exam or procedure, and you can request a medical chaperone with a specific gender. Your provider may also request a medical chaperone be present to observe or assist. A medical chaperone is a trained member of the UHS medical team who ensures that you feel safe in a vulnerable situation. The medical chaperone is trained to observe for signs of patient discomfort or pain, answer questions during the exam or procedure, and assist as needed. Although UHS has student employees in our clinic, a student will never serve as a chaperone. Medical chaperones will stand in a place where they can actively see both you and the provider. You may hear a medical chaperone use certain terms when they communicate with the provider, like "please explain" reminds the provider to communicate each step of the procedure or exam with the patient. "Please move to the left, right, or another direction" asks the provider to adjust their position if the medical chaperone cannot see the entire field of view. "Please pause" is a cue for the provider to temporarily stop what they are doing due to patient discomfort. "Time out" is said when the provider should stop immediately or when safe to do so because of significant patient discomfort or because the medical chaperone is uncomfortable with something that happened during the exam or procedure.
Once your exam is complete, the medical chaperone will usually leave the exam room with your provider to allow you to get dressed in private. The provider will go over with you any findings from the exam or procedure and answer any questions you have. Our goal is to provide all of our patients with high quality, culturally responsive care in a safe and welcoming environment. There are several ways to report concerning behavior during a sensitive or near sensitive exam. Visit uhs.wisc.edu/chaperone for reporting information. For more information on UHS services, visit uhs.wisc.edu. Take care.